Hello and welcome to the channel. I would like to thank you all for the great support we received from all of you. We have crossed 1000 subscribers. Not only that, viewership has gone to more than 35,000. All this just in the last 6 months. That's amazing. Thank you very much. It also means the content we make is adding value, is helping you to stay healthy. And with the same intention, we are bringing today's video. Today we want to talk about metabolic energy disorder. It is a silent killer. I put a link down for the article. You can read it yourself and see how alarming it is. For this, I have invited a specialist, Dr. Kuldeep. He has worked in this area. He has some innovations. Let's log in and find out what he has to tell us about what metabolic energy disorder is and how we can protect ourselves, and if we are suffering from it, how we can move out of it. Stay tuned. Let's find out more. Hello, Dr. Kuldeep. Welcome to the show. I hope you are doing well today.
Absolutely, Sunil. Thanks for inviting me to this
I
talk.
I have to thank you for taking your time off today to talk to us. And the topic I have today for you is about metabolic energy. I want you to tell us what metabolic energy is and what is metabolic energy disorder. People are not
Sure.
aware about it, and it's a very exciting topic. In the intro, I told my audience about an article. I shared the link also where they can find a lot about it. But I need to speak to an expert to simplify it for us. And I think you are the right person for it. Over to you.
Thanks, Sunil. Before I start, I want to say this that metabolic energy disorder is either a primary or a secondary cause behind all the diseases in the world. See, Sunil, everything needs energy. Suppose we are talking, we need energy. Suppose we have to think, we need energy. If we have to walk, we need energy. So, the energy that is produced within our body by complex process of breaking down the food, and we are able to attain that energy. Now, this energy at a cellular level is stored in a molecule called adenotriphosphate, which is called ATP. Now, let us get on to metabolic energy disorder. If a human being is not able to produce or utilize the energy produced, leads to metabolic disorder.
Thank you, doctor, for explaining what it is. And it's very interesting to know that it is the common denominator, as you said, for most of our lifestyle disorders. Okay, now I have another question for you. Since it is important for us to know about it, it will be good if you can also tell us about what are the types of metabolic energy disorders, or you can talk about some symptoms so that we can correlate and find out in our own life if we have them or if anyone of our family member has that. Can you talk a little bit about the symptoms?
Sunil, so when we are talking about metabolic energy disorder, so there are a lot of symptoms. It's a host of symptoms, and it can take the whole day to tell about those symptoms. But I would say some of the key symptoms. When you don't have energy within yourself, the first thing is that you will feel lack of energy. You will feel exhausted. You will feel fatigue. So this is a very classical symptom of this. Other than that, if you see sudden weight loss, weight gain, high blood pressure, low blood pressure, uh, uh, diabetes, either hypoglycemic or hyperglycemic. So these are some of the symptoms that go with this. But I would say the classical symptom is the body temperature. So because metabolic energy is directly proportional to the temperature. If your body temperature is lower than specific range, you have a low metabolic energy disorder. If it is high, you have a high metabolic energy disorder. So temperature is a classical symptom that I would say.
Thank you, Kuldeep, for clarifying. And I just want to ask one thing. You said it's about the temperature of body. Is it related to hot and cold? Like, for example, these days in Australia, it's a bit cold. So I do feel cold many times. I'm sure many others. And in India, it is hot. So they must be feeling hot. Is it something that you are saying, or is it something else?
That's a very good question. It's not about feeling hot or cold. Yeah, that at times is an indication, but The temperature I mentioned about is the basal body temperature, so which is generally taken when you are in the bed. When you get up in the morning, before coming out of the bed, you place a mercury thermometer under your right armpit for 5 minutes, and if your temperature is between 97.8 to 98.2 is the right temperature your body is supposed to be having, and that is you are fine. But if your temperature is less than 97.8, it's called low metabolic syndrome or disorder. And if your temperature is more than 98.2, it's called high metabolic energy syndrome or disorder. Hope that
Okay.
clarifies.
Yes, yes, it clarifies, and I can correlate it with the stove, gas stove. If we keep the temperature low, we will not be able to cook the food. We keep it high, it may burn the food. So something similar the body has. So it needs the right
Exactly.
temperature to do the right activities. Okay,
Absolutely.
that clarifies. How big is this problem? Should we worry as a society? Is it a small one, small portion of people are impacted, or is it tip of the iceberg? What is it about?
As per stats, over 1 billion people are already affected with this disorder.
Ah, oh, it's a
And
quite big one.
and absolutely. And experts are saying that this is just a tip of an iceberg. More and more people need to be tested before they are decided whether they are in the normal state or they are not in the normal state. So I don't, and I think every year there are a good number of people adding up into this list. So it is a big problem actually that we need to be worrying about.
Thank you, doctor, for clarifying that. I have a question. What would be the cause of this? What's causing this? You said it's a big problem, it's a tip of iceberg. So what is causing it?
Yeah. In my clinical practice, I have observed five critical things that actually impact uh, the metabolic energy. Number one is thyroid dysfunction. Number two is adrenal gland dysfunction. Number three is hormonal dysfunction or hormonal imbalance. Number four is ATP is held back. We spoke about adenyl triphosphate. It's been held back in the body. And the fifth one, I have seen that severe caloric restrictions. People just decide they want to do intermittent fasting. So, a word of caution for all those people that please go and take an advice from a professional before you actually onboard to a journey of intermittent fasting. People with metabolic disorder are strictly not recommended to follow intermittent fasting. It will damage you more than it will help you. And I have number of patients visiting me who actually onboarded onto the journey of intermittent fasting and then landed up having more problems, for example insomnia, and so on and so forth. So that is a strong suggestion that I would like to give to people.
Okay, thanks. Thanks, doctor. I want to ask one question. It may sound a little funny. We have talked about it. How easy it is for a person to detect it. Can I find it out that do I have it or I don't have it, or I need to go to a specialist to know that I have it or I don't have it?
When it comes to an individual, he or she can diagnose it at their home by doing this temperature test, right? But identifying the real root cause behind what is causing this dysfunction is a job of a specialist. It cannot be done by any person because it's a very complex process where multiple bodily functions are involved. So it needs a specialist to identify or diagnose what is causing it.
Okay. So to sum up, what I understand is at home, if you do the body temperature test by putting the thermometer under your right armpit, it should be in this range. If it is outside it, it is an indication that you have it. And then you need to go to a health professional, a doctor, tell him all your symptoms, and then he can recommend certain tests and clearly tell you what is causing this so that he plans a journey of your wellness. That's what it is. Sounds
Absolutely.
great. Okay, doctor, thanks for clarifying all this so far. Is it possible for you to share with us some case studies, the challenges you faced, and how you used your innovations to detect and finally treat them? Of course, without naming the patient, I can understand. Uh, Privacy is important, but it will be good to know how and what you did to overcome those challenges and how you finally help the patients to walk healthy.
Absolutely, Sunil. I think it's a very interesting topic, and I would like to throw some light without naming the patients. Uh, as you said, challenges. I would say there are a number of challenges that I would like to present here. Challenge number one is thyroid testing. There is not enough testing being done, and my based on my clinical experience, 50 to 60% of the patients are only tested for TSH. Then remaining 20 to 30% of the patients are tested for TSH, total T3, total T4. At times, that also doesn't help diagnosing the problem. And only, I would say, 10 to 20% of the patients are being tested for, uh, you know, uh, the complete testing that we need to do, like total T3, total T4, TSH, then free T3, free T4, which is an excellent way of testing the thyroid dysfunction for a particular patient. And I would encourage more and more practitioners taking that route and helping patients to diagnose the problem. At the same time, autoimmune, I have hardly seen autoimmune tests being prescribed. Uh, Even if there is a smallest suspicion, I think we shall actually go forward and get those tests done. And in this regard, I would like to present a case study. If you can move on to the next slide, Sunil. Uh, if you see this patient in his mid 40s, a male patient in his mid 40s, working as a senior executive in one of the top MNCs, struggled for more than 2 years with hyperthyroid syndromes like anxiety, insomnia, migraines, and stuff like that. And what was happening every time he was getting tested for thyroid, and it used to come like this. It's a normal, perfect thyroid profile for any patient. But when he visited and explained his history and other things, and it became very clear for me that there's a metabolic disorder with this individual. So I he came because he had already gone to a number of practitioners and without getting any good results. He came with a bunch of test reports and with a very little faith because he was recommended by someone. So I asked him to do this thyroid test along with doing 3T3 and 3T4 because it was somehow very clear to me that there is something going on with this individual. So if you click one more time, so when we got the tests done and when the results came, there was some faith built in him because he was worried all along that he has been having some problem and there's no diagnosis of this. Now, with this test, it was very clear that there was something going on with him, and we started with the treatment. And after while we were on the journey, he already had restored his sleep had got restored. He had uh, he hardly had any anxiety issues now because he had started focusing, and it was after a long time that he started focusing on his work and was able to do things what he wanted to do in the right manner. So after close to 3 months, when we got the tests again done, if you click one more time, and this is the kind of result that we got for him, that his things were more or less getting normal, and he was on the path of normal track. Now, it's been more than 2 years for this individual, and I have not heard anything from him. So I'm hoping that he's doing fine.
That's very good. And I get a feeling that although he gets well after 12 weeks, but the good things start happening much before that. So maybe week 5, week 6, once he's diagnosed properly and he's treated well, that's good. Let's talk about one more. I know you have shared one more challenge. So let's go to the next one.
I would say this is a bigger challenge because the thyroid range, which is a normal range, at times actually confuses the diagnosis. So initially, when I started practicing, we used to prescribe, start the treatment, but then uh, even after doing the right medication and treatment, I personally felt that the symptoms of these patients continue because if problem is fixed, then you shall not have those symptoms. While as the tests after tests were coming, perfectly right as per the normal range, and that actually forced me to actually do this innovation. It took a while, but I was able to do this innovation where I am able to derive the thyroid range for an individual based on his or her constitution, like height, weight, blood group, stuff like that. And I can tell you, ever since I have been able to do this, I have helped a lot of patients in getting over the symptoms and getting back to the normalcy, which was not possible earlier. So if you click one more time,
I
I
think
have a case
before
study.
you go further, Doctor, I want to add a little bit more to clarify for myself and audience. So you are saying that the thyroid range is generalized globally, but normally what happens is it cannot be like that. There are certain people who have different body composition, and for them, the it may be slightly here and there. So we need to arrive at a unique thyroid range for every individual based on his constitution. And when you do that, that's where actually you can capture the problem and then work on it. That's what you are saying, right? Is that right?
Uh, Absolutely,
Okay.
absolutely, because it's very unique to an individual. It is not a generalized thing. Now, this case study is very typical of this, thyroid range. A female in her mid 80s was a is a was a is a retired professor and was head of department in one of the very prestigious colleges and has been on a wheelchair, unfortunately, for a long period, having edema and being little overweight. So she has always been tested for TSH, never been tested for anything else. So if you click one more time, so after listening the history and other things, I asked her to do this particular test, and it actually showed that there was a problem with the test. And we continued working. I continued treating her, and after whatever you see here, it's after 12 weeks or 14 weeks that we got these kind of results. And if you see on the right side, there is a WhatsApp message which was sent by her son saying that the thyroid medication has worked wonders and her swelling has come down, and she also lost almost 4 or 5 kgs, and she was able to walk after a long time. And I think that's what this thyroid range has helped her and so many other patients, but specifically her because she was not able to walk. She was not able to get up from the wheelchair. Yeah.
That's amazing. Nice.
So I go to challenge number three, which I typically see that adrenal diagnosis is hardly being done. With my clinical experience, if you see the stats down, with thyroid dysfunction, there were only 47% of the patients who came with thyroid dysfunction, but there were 80% of the patients had adrenal dysfunction. Now you can understand the significance of identifying adrenal dysfunction because it is it is a major cause behind a lot of metabolic disorders. So this is rarely been diagnosed, and with this uh, the innovation that I have, I'm able to diagnose this problem in a much better way. If you can click one more
Yeah,
time.
doctor, before we go there for the benefit of audience, because I'm sure many people know thyroid, but many don't know adrenal. Can you say a little bit what adrenal is and when it is used? And
adrenal glands are, walnut-shaped glands which reside on top of the two kidneys. Uh, in the adrenal gland, there are two type of glands. One is called adrenal cortex, and you might have heard cortisols, which is produced by the
Yes, yes.
adrenal.
Very
Yeah,
popular words.
yeah, it's produced by adrenal cortex, and inside is called adrenal medulla, which you might have heard adrenaline rush and stuff like that, and that is the hormone, uh, produced by the adrenal medulla. So both adrenal cortex and adrenal medulla are very, very important. They are at the center stage of the stress.
Okay.
So the
Now,
so
now
the
it's clear.
Yeah, so the brain actually triggers adrenals to handle the stress. It actually asks heart to pump and get more oxygen, and pancreas to produce more sugar, so that body gets energy to fight. If there's a fight and flight the situation, the adrenaline is triggered. But in general stresses, cortisols are the first line of defense, and they are produced. When the cortisols are produced beyond a particular level, that causes problem. That causes inflammation, which is a major cause of death in the modern world.
Okay,
So,
thank you, doctor. And let's go to the case study now.
so sorry, a female in her early 40s suffering from chronic fatigue syndrome, insomnia, and low blood pressure. And all most of our tests were coming normal, and it was so happening that he was able to. She was on, she was managing, pulling on things on day-to-day basis. But when we got this test done and we started investigating, and we figured out that this uh, female had chronic stress syndrome, and that was regulating down her thyroid issue. She didn't have any thyroid issue per se. She had adrenal dysfunction, and after working on, started with the treatment. If you click one more time, this is the result that we got. She got back to her normal self. uh, all the symptoms of fatigue and chronic, lethargy was gone. Our blood pressures started becoming coming normal. She was able to sleep well, because that was the one symptom that she was very, very clearly able to see, and she was more energetic. He had again started going back, doing her normal walks and exercises and stuff like that, which was not the case. She was not able to do anything. He was not interested in doing anything because she was always feeling tired. So that, uh, again, this innovation has helped in identifying the problem here.
This is very interesting, doctor. If I go to the previous slide, if we see one view, which doctors generally do, they treat only the low blood pressure, or they treat only insomnia, or only the fatigue. But what you have done here is you have seen the complete view, the system level view, the complete view of the body, and then put all the pieces together and did this adrenal dysfunction test. Because if it was not done, if we do only the thyroid thing, she might have eaten medicine for thyroid for life and never got better. That's what these numbers tell me. And what you have done is you have done the complete view and then put the pieces together to find the actual root cause. And probably that's one big reason why she was fine in 16 weeks time. So I think that is a very nice innovation because it helps you to identify the root cause. And normally we say in life, if you know the cause, you can find the remedy. But if you don't know the cause, you are shooting in dark, the remedy is never going to come. So that's nice. Let's go to the next one. You
Before
have
we go
one
to
more
the
case
next one,
study.
yeah, before we go to the next one, I think it's very, very important to understand the holistic approach, because that brings in the value here, rather than doing a individual systemic approach. So I think holistic approach is important in diagnosing all that. Coming to the next challenge is hormonal dysfunction, because there is, I would say, in males it's testosterone, and in females it is uh, estrogen dominance, especially when during their fertile period. So it's very, very important to diagnose this problem. in the right manner so that we are able to support the patients in the right way. I am talking about a male in his mid 40s, suffering from lack of energy, weakness in the extremities. He was feeling little weakness, and he had erectile dysfunction. So, uh, so when we got the test done, which is a testosterone, very simple, straightforward test, and it showed us that what was causing this, because we got the other thyroid things also, thyroid profile also done, but it was very evident that he's been suffering with low testosterone levels, and we started treating and working to improve his hormonal health. And after I think 12 or 16 weeks, if you can click one more time, this is what yeah, after 16 weeks, this is
Mhm.
what we got. And he had he had again started feeling energetic. His erectile dysfunction had gone. His weakness, the the most worrisome was his weakness in his extremities, because that was causing, it was somewhere telling him it's a motor neuron, somewhere telling him something. His movements were a little bit restricted. So uh, he had overcome to all these problems after he started recovering with his testosterone level.
Amazing. Autoimmune is your next case study.
This is classical. Another challenge is lack of getting these autoimmune tests done, which is called Hashimoto test typically. Uh, so a female in her early 30s was suffering from chronic fatigue syndrome. She was feeling always sleepy. He had also high blood pressure, and and there was a classical symptom with her, and that actually forced me to get this test done. She was saying that I feel that something is getting eaten up inside me, and it's a very classical thing. And I asked her, please get your autoimmune test done, and this is what the results came. Had not had we not done this, she would have lost her thyroid function over a period of time, because uh, it was a clear hypothyroid case, while as what was causing it was the autoimmune disease. So we had to fix the autoimmune disease, which will eventually, in the longer run, fix her thyroid dysfunction. So we started with the treatment, and if you go to the next click, and she's still, yeah. So we actually improved her, reduced her autoimmune disorder to this extent, and she's work in progress. And I'm sure in next few weeks she will be out of all this. And if you see, her thyroid function has improved drastically, and now there is not to that extent. Still, it's an autoimmune disease, but not to that extent. And as I said, it's work in progress. Soon she will be out of this. But this is how our thyroid profile improved. Very important thing.
Thank you, doctor. For the benefit of the viewers, I want to say that autoimmune is a situation when your own immune system gets confused and it attacks an organ. Autoimmune is very common, particularly with thyroid and liver. There are many, but these two are very common and it's very difficult to detect. So I'm good to see this case study in your list, doctor. Thank you. And we have a challenge number 6.
I it when you are not able to diagnose the problem properly, you cannot do the medication also properly, right? So there are situations where you have to at times medicate or treat person for thyroid dysfunction. For that, there is a different type of a medicine. At times, your body is not able to convert your T4 into the proper T3, and has been held back, where you actually see issues like females who are having PCOD. You see estrogen dominance there. You also see that there are toxins in somebody's body, like heavy metals, like lead, mercury, and stuff like that. That also helps back the ATP and doesn't allow the conversion. And this conversion of T4 to T3 happens in 60 to 70% happens in the liver. You just mentioned about liver. So liver uh, fatty liver is a classical syndrome, which I have seen of late with a good number of people, and their conversion from T4 to T3 is impaired. In case of estrogen dominance, it's impaired because of the estrogen. So there are many reasons. Some people have fatty liver because of because of genetics, because of the kind of food they are taking. Uh, um, it's also the conversion is also restricted because you have toxins or you have hormonal imbalance like estrogen dominance and stuff like that. So that's where we need identify the problem and provide the right medication so that we are able to recover the patient, to, to, to the normalcy as soon as possible.
I think the advice which you gave or the methodology which you are using, the holistic, that's the key here. When you see the full body as a unit, and that's making the difference in diagnosing and finding the root cause and then applying the methodology for healing. I have a case study number 6 on the screen, and I would request you to take us through that.
Absolutely. If you see in this case, the patient was fed with excessive T4 medication, which had actually landed her. It was she her into a hyperthyroid side.
Okay.
Yeah, so she had started feeling anxiety. She had started feeling insomnia, palpitation and stuff like that. Uh, so then that's where we need to, the dosage part is also very, very, very important, because if you are dosing somebody and if you see uh, here, it's the patient has from hypothyroid, they have gone into the hyperthyroid syndrome, and she had all the hyperthyroid, symptoms. If you click one more time, so we did the correction with the medication, and this is what medication and some treatment, and this is where we achieved this. I think in 8 weeks, something like 8 or 9 weeks, and this is what we got. But as I mentioned earlier, before we actually go to the testing, the patient himself or herself says that she is feeling better. She is getting normal. She is
Okay.
so if so if we get an early warning by asking the patient how the sleep has been, how energy has been, and how other things have been. And the tests are proof that what they are saying is perfectly all right. And if there's
So,
any further correction required.
so what I get from you is here that although you give the correct treatment, you also give correct medication, but you also keep a good contact with the doctor, with the patient, and try to get the feedback, what the body is saying. So you are using the body also as a good tool to tell whether the medication is going in right direction, whether it is working or not. And so you know it's going right, and then you keep on making adjustments. So it's the best of both worlds which you are using, the medicine, the treatments, and the body communication. So
Absolutely.
it's gives a complete closed loop, which is very good.
Absolutely.
What else we have today? Do you have any other case studies, doctor? Or
No, I think these were, some of the classical on top of my mind, which I wanted to share with all of you, so that you have a feel of this, because it's a very complex thing. It's not a very simple, straightforward thing, and because there are so many other things at the background going on, in terms of emotions, in terms of diet, in terms of so many things. So it's not a standalone thing. I have presented you a very simplified view, but it's a very complex subject, and it needs a professional to guide and help you.
thank you so much, Kuldeep, for sharing us all those case studies. The key takeaway I have from them is number one, it's important. It makes a lot of sense to go for holistic healing rather than organ wise healing, which is very popular these days. Holistic healing makes a difference because a specialist sees the body as a whole. Communication with your specialist is important, telling all your symptoms to him so that he gets a complete view what's going on inside the body, not only inside some particular organ. Then your innovations, They're very nice and very eye-opening, and it was so nice to see how you made difference to so many people. And your research has been helping all the time for last so many decades now. You have helped many people to this. Thank you for sharing those things with us. Before I let you go, I still have some question for you, and the most important one out of that is to know from you some self-care tips which we can do. You know, there are these days there's a trend of do it yourself. What can we do by ourselves to, if not get well, at least stay away from them and make things better?
Uh, sure. So some of the tips for people who are already suffering with hypothyroid disorder. So one is if they are taking a high dose of medication, I would highly recommend they split the dose into two doses because it will actually help them to reduce the stress on the adrenals because thyroid and adrenals are inversely proportional to each other. So the energy produced by the thyroid, if it's not been able, if adrenal is not able to handle it, it will crash. So to avoid those crashes, if you are taking, say, 100 mcg medicine, split it into 50 early morning, empty stomach, and then uh, uh, after lunch, 2.5 hours after lunch. Avoid taking it in late in the evenings, but it might interfere with your sleep. So divide the medication into, two or three, depending on how you want to do it. Uh, Second is if I have seen a lot of people taking iodine, and if you have autoimmune disease, I would strongly recommend not take it because it might flare up your condition further. So
Mhm.
be really careful when you are taking iodine as a supplement. You have to go slow, very very slow, very low dosages. You can try that, but don't do because it might flare up your problem further. Third is I have seen in a lot of countries the water that is being the water is cleaned with either chlorine or fluorine. So if there is a uh, you know, um, very heavy usage of chlorine or fluorine to treat the water, it will definitely impact your thyroid. So be watchful on what kind of water you are taking, what is the amount of chlorine or fluorine in the water, because that is a cause behind your thyroid dysfunction. Though iodine actually, they in the periodic table they are in the same group, but fluorine and chlorine create the dysfunction, and iodine helps to supplement or help to support the function. So be careful on that. Last is food. Please avoid glycogenic foods like uh, cauliflower, uh, you know, so things which fall in the glycogenic foods. Please avoid them because they
This is for
interfere with
people
your.
who have this is for people who have thyroid problem. They need to
Yeah,
avoid these type of
exactly.
foods. And is it that
Agree.
they can totally off the plate, or maybe they can have it once a while or in the morning, or is there something like that, or totally should be out of
So
the plate?
ideally out of the plate, but
Ah, okay.
once in a while you can have it. Yes. Yeah. Now, when it comes to if somebody is really aware that they have a adrenal dysfunction, very very important. Avoid potassium and phosphorus rich foods. It's
Okay.
very very important for people. And also, I have seen people, they come and say that, I have taken banana and I got these symptoms. Because banana is a superfood, but in in cases where you have adrenal dysfunction, it's like a poison. So be careful. A lot of people take coconut water. So be careful because coconut water is also high in potassium. So you have to avoid foods which are high in potassium, like dried figs, raisins, dates, oranges, grapefruit, you have to avoid if you have thyroid dysfunction. Sorry, if you have adrenal dysfunction, not thyroid dysfunction. Uh, we classically see that we take fruit and fruit juices for breakfast. When you have a adrenal dysfunction, you have to avoid that. Very, very important. In adrenal dysfunction, you
Is
have
it
to
for
avoid
all
that.
fruits or a special or some special fruit? All
All
fruit?
fruits, all fruits, all fruits and fruit juices you have to avoid in the breakfast. Avoid in the breakfast. So
Okay.
that's where I'm.
Lunch is
Uh,
fine. Is that what you're
you
saying?
can, yeah, lunch is fine. You cannot start the breakfast with these things.
Okay.
You have to avoid taking coffee, black tea, hot chocolates, alcohol, colas, chocolates, fermented foods, apple cider. You have to avoid that if you have adrenal dysfunction. These are all great things, but your body state is not. Your body is not in a state of actually, accepting it.
Yeah,
So
it's not the right. It has to wait till heal and then maybe we can start it again. Yeah. Because I see a lot of people talk about these things. They are all superfoods. And the problem is, I'm not sure if there is any research, but definitely I know because of social media, everyone makes a video today and it must have created a lot of health problems. Unfortunately, the data does not support, but I have a feeling it must have because every now and then somebody makes a video that this is good, bad without any research, without understanding who will read it, who will eat it. So thanks for clarifying all this. This is so nice. And the takeaway I have here is that there is a lot which we can do, but important thing is we need to connect our bodies. We need to keep a watch. What is the feeling after we take the food? Like you said, banana. So if I'm taking a banana, after that I feel miserable, it means I should take it off the plate. So we need to listen to our body as well and see some good professional, talk to him, show him all the symptoms we have. And I want to ask you, doctor, one thing. So after the end of this video, I will put your contact details so that if anyone wants to reach you for his thing, he can reach you directly and you can take it further for them. Is there anything else you want to say before we hang up today?
I think, again, one, go to a professional if you are feeling any of these things. Go to a professional, take a professional advice, take a professional suggestion, and then start your, because these are all very complex things. They look very simple, but they are all complex and will impact your health in a positive or a negative way, depending on how your body is reacting to it. So I wish you all the best. Thank
I
you.
would urge everyone who has tried a lot of doctors and things have not worked good well. I will send the contacts of Dr. Kuldeep. You can reach him because sometimes holistic healing makes a big difference. Thank you, doctor, and thanks everyone for watching. Have a good time. See you soon. Bye for now.